of ICEMC 2021. I hope everyone is here. I can see that Mr. Morrison is here.
Yes.
Okay, great. How about Associate Professor Dr. Shahida Matno? I think she hasn't come in yet. Miss Fei Yang Chen? Also not in yet. And Mr. Muhammad Hafifi Jamri? Also not in. Is it okay if we wait for a few more minutes, Mr. Morrison?
Okay, that's right. That's fine.
Okay, all right. Thank you so much. First of all, I would like to welcome everyone to this presentation or this session, the parallel session of PALKA LESTARI. In this occasion, we have 4 participants. At 10 a.m. it would be, now it's going to be 10:12 a.m. It's going to be Mr. Morrison from Universitas Mercu Buana. He will talk about the influence of anti-smoking campaign on willingness to quit smoking. And then we will proceed with Associate Professor Dr. Shahida Matno from University Science Malaysia. She will talk about transcending pandemics, the centrality of communication in building community resilience. And then we will proceed with Miss Fei Yang Chen from Northeastern University, China. She will talk about community mobilization based on new media in the context of epidemic prevention and control. And lastly, we will be listening to Mr. Muhammad Hafifi Jamri from University Science Malaysia on the study on the use of electronic media in drug abuse campaign. So I hope everyone is ready. I hope everyone is in a good shape wherever you are, whether at home or at your universities. Can we start with Mr. Morrison?
Okay, thank you very much.
Okay.
Let me share screen my PowerPoint. Do you see my presentation?
Yes, I do. You may
Okay.
proceed, Mr. Morrison. Thank you.
Okay, thank you very much. Good morning, everyone. My name is Morrison from Universitas Mercu Buana in Jakarta. On behalf of my other partners, I would like to present my research outcome entitled "The Influence of Anti-Smoking Campaigns on University Students' Willingness to Quit Smoking." So as an introduction, we may know that at least people in Indonesia aware that the government, along with other stakeholders, are trying to impose anti-smoking campaigns. So, however, although anti-smoking campaigns were frequently carried out in Indonesia through various media, but the number of smokers in Indonesia continue to increase. So the study investigate how far can anti-smoking message be effective actually, with a focus among university students, and how much do they want to quit smoking. So the study intend to investigate the effectiveness of the anti-smoking campaign so far launched by the government towards university students, especially those who smoke. So anti-smoking campaign are actually campaigns for behavior change, which mean encouraging people to change their knowledge, attitude, and action related to smoking behavior. Because the psychological and social process that drive behavior change depend on many factors, various theories tend to emphasize certain aspects that are thought to trigger change. One of these theories is the health belief model that identifies two factors that influence individual behavior to protect their health. So there are two factors here. First is the feeling of being threatened by disease, and the belief that the benefit of adopting behavior to protect health will outweigh the sacrifice to adopt it. So among university students, smokers who had been exposed to anti-smoking campaigns, this study examined the campaign's effect on their belief and attitude. In each campaign and through various media, anti-smoking messages delivered risk or harm of smoking, such as smoking causes cancer, smoking causes a heart attack, smoking kills you, and so on. So despite this warning delivered through many media, this raises the question on belief on message contents. How far can this anti-smoking message be trusted by smokers, especially among student smokers? So based on theories and previous studies, this research tried to identify factors that influence smokers' willingness to quit smoking. So the dependent variable in this scheme is a will to quit smoking. So the independent variables start from demographics variables, age, education, income. How these demographic variables among smokers factors into their will to quit smoking. And we have here some other mediating variables. Belief on campaign contents, for example, their attitude on anti-smoking campaigns, and also smoking frequency. So how these variables interact to each other and influence smokers in how they will their willingness, how this variable affect their willingness to quit smoking. So we propose 5 hypotheses based on the previous studies and also theories. For example, H1, the rising hypothesis is there's a significant influence on demographic variables, age, income, and education, on belief in the content of anti-smoking message. Second hypothesis, there's a significant influence on demographic variables, on attitude. and also the influence of demographic variables on the frequency of smoking, and there is a significant influence on the belief and attitude of smoking frequency. And finally, there's a significant influence on demographic variables, belief, attitude, and smoking frequencies, on the willingness to quit smoking. So all these variables joined together influence the willingness to quit smoking. How far all these other variables influence smokers' willingness to quit smoking? So I have five variables that examines during the studies. So this study used a survey method involving 502 students in Jakarta. Data analysis was performed using some statistical instrument, including correlation statistics, standard multiple regression, and hierarchical multiple regressions. So this is the findings with regard to the descriptive data. For example, in terms of the respondent age, we have the youngest is 16 years old and the oldest is 57. Smoking duration, for example, here we have in months the shortest smoking duration is 7 months, but the longest is 469 months. Cigarette number smoke, the least is 1, but the maximum 39 sticks per day. Yeah. So I don't have to elaborate one by one all this data. And table 2 also their belief level in cigarette as a cause of various disease, cancer, heart attack, important fatal abdominals, or cigarette kill you. So this is you can see this the data we got here, and also the attitude. We also measures the attitude with regard to the anti-smoking campaigns. For example, we raised the question to the respondent whether anti-smoking campaign overstates smoking risk. So 46.8% they said they agree or strongly agree, 30.2% neutral, 23% disagree or strongly disagree. And also we raised question about with regard to anti-smoking campaign overstates smoking risk to others, and so this is the data also. The willingness to stop smoking is in table 4. We measure their willingness to stop smoking by several indicative questions. For example, smoking disrupt my health. So they have 39, almost 30% agree, 30.9% neutral, and 29.5% disagree. So others indicative question also said here: smoking disrupt my economy, cut down smoking habit, cut down cigarette numbers, and quit smoking. So this is the way we measure their willingness to stop smoking. So as a conclusion, after analyzing the data with statistical instruments, the following conclusion can be put forward. First, there is a significant influence of demographic variable, age, education, income, on trust in anti-smoking message content. So, for example, the higher your education is, the more your belief on or anti-smoking message content. There's also a significant influence on the demographic variable on attitude toward anti-smoking campaigns. There's a significant influence on the demographic variable on the smoking frequency. There's a significant effect of trust and attitude on smoking frequency, and there's a significant influence on the demographic variable, belief, attitude, and smoking frequency on the desire to quit smoking. So, in conclusion, all variable that I put forward in that structure of the variable is influence the willingness of smoker to quit smoking. Finally, how strong each variable that we have discussed into the willingness into people's behavior to quit smoking. So the four variables examined in the study, namely demography, belief, attitude, and smoking frequency, had a significant effect on the desire to quit smoking, where the smoking frequency had the greatest influence. So R square is 22%. So it means that the more frequent somebody smokes every day, the hardest for them to quit smoking. So the smoking frequency has a factor of 22% in the willingness to quit smoking.
Mr. Morrison, you have 5 minutes more.
Okay.
Okay.
So after the smoking frequency, followed by belief and attitude, that's so almost the same contribution as square 21%. And finally, the demographic variable saw the smallest contribution to the variance in the desire to quit smoking. So R square is only 1.2, 1.3%. So from this study, we conclude that the more you smoke, the more smokers smoke, the harder for them to quit smoking. So I think it suggests that for those who already smoke, for heavy smoker, they have to first gradually cut their cigarettes number per day in order to quit smoking. And also belief and attitude towards campaign message also play significant factors. If you don't believe that smoke cause cancer or smoking cause heart attack, you won't be able to stop to smoke among the smokers. Yeah. So that's why belief and attitude on the campaign message are important factor in this study. Okay, that's all from me. Thank you very much for your attention. Thank you.
Okay, thank you so much, Mr. Morrison. That was a very interesting presentation about anti-smoking campaign in Indonesia. So right now, I would like to open the floor for everyone inside the parallel session to ask any questions for Mr. Morrison and about his study. You may ask via chat, or you can just open up your mic and ask any question. Any question? Okay, since our other participants do not have any question, but I do have one question for you, Mr. Morrison. Okay, based on the data that you have collected and as well as the results that you have mentioned just now, can you just share what are your recommendations for future research on the matter? You know, maybe for those who are interested to learn more about how anti-smoking campaigns are effective in terms of changing a person's behavior. Would you comment on that?
Yeah, I think we have to set a different strategy, yeah, for different segments of smokers, because as you know, in based on my study, there's variables. For example, smoking frequency. There's a difference attitude between heavy smokers or light smoker, those who already smoke so many years, and those who just start smoking. So I think for the government, in order to launch the anti-smoking campaign, they have to make a different strategy for different segments, because I think today in Indonesia, for example, all the campaigns, the anti-smoking campaigns, was exposed for everybody, for the same level. There's no difference in terms of the message objective with regard to the audience segments. I think one of the my recommendation, our recommendation is that. Thank you.
Okay, I believe so too, because when we do content for certain advertisements or campaign, it must be adhered to a certain target audience. So like you mentioned, maybe different segments, whether it's heavy smokers or light smokers, would really need a different set of content or maybe message for them to actually impact their life or their knowledge, as well as their behavior. Okay, thank you so much, Mr. Morrison.
Thank you.
Okay, is there any questions from others in the group, or if not, we can proceed to the next presenter. Eddie, are there any questions? Okay, all right, thank you, Mr. Morrison.
Thank you.
Okay, we would like to proceed with our second presenter, which is Associate Professor Dr. Shuaida Matno from University Science Malaysia. You just now, I forgot to mention that we are only given 15 minutes, okay, for each presenter. So during the last 5 minutes, I would notify the presenter. Okay, thank you so much. Okay, you may proceed, Doctor.
Okay, hang on, yeah. I'm trying
All
to
right, no
load
problem.
how do I do this? Hang on.
Sure, no problem.
Okay. All right, sharing screen. You can hear me well, yeah? Dr.
Yes.
Atika? Thank you.
Yes, very clear.
All right, hang on, so presenting. Okay. And I'm sharing my screen. I hope you can see
Yes,
it.
we can see it.
All right, thank you. So today I'll be presenting on our research. Well, this is a proposal actually for research that we plan to do in the next coming year. So it's about transcending a pandemic, COVID-19 specifically, and using communication as an enabler to facilitate in enhancing community resilience. Yeah, so I'm speaking on behalf of my team. Dr. Atika is in here too, Dr. Hasrina, Dr. Edmund Mo Chun Hao, and also Prof. Mastura Jafar. So I'll start the presentation by giving some background on what I mean by what I mean by community resilience, and after that I'll be sharing some research that I've been involved with in 2020. The findings that we've got on community resilience based on our research in the northern part of Malaysia, and from there the findings from there that had pushed for this new research. Yeah. Okay. So with COVID-19, we all know that it had started in 2020, if not late 2019. Yeah, and previously it sort of get us by surprise with the extent that of the impact that it has. But previously we've gone through several pandemics such as the Spanish flu and influenza. In 2009, we've had SARS in 2002 and MERS in 2012. Both are linked to coronaviruses with different strains, of course. And we have also lived with corona ongoing. Yeah, we are living with coronaviruses aside from COVID-19 in the forms of common cold, actually. So for many years, we have been adapting the vaccines for common cold. Common colds are always being updated yearly. That's why we have to get a vaccine. For those who are interested in common cold vaccines, flu vaccines, we have to do it every year. So these things are foreseeable that pandemics are here with us. Yeah, it's something that it should be expected. Yeah, so it has happened before and it will happen again. And WHO has insisted that pandemics is now part of our life. So by right, we should have prepared for it. I've read an article that was in 2006. Yeah? The things that were talked in that article are similar. The predictions are very similar to what we are experiencing today, especially in terms of the economic impact. Yeah? So it's sort of something eerie for me to read that from an article in 2006 and see what's happening here, what they had predicted happening today. So we tried to prepare. We for what I have here in this slide is what countries all over the world, with the foresight that there are pandemics that we have to face. So we try to prepare. Yeah. So countries will have dedicated units, agencies to address diseases and pandemics in terms of prevention, mitigation efforts. Yeah. We looked at point of entry, when to stop people from coming in if there's a case of pandemics. Here we have a vaccination. We are prepared for vaccination. We have awareness, public health communication system in place. Yeah? And then for detection, we know how to do it. Resources, many countries have stockpiles of personal protective equipment. We have recovery capacities, but with all this in place, we have yet we could not, nothing could have prepared us for what COVID-19 presented to us in 2020 and 2021. They're still ongoing for Malaysia especially. Yeah, so this is where we are today. If I can share this slide with you. Yeah? This is the statistics that's on Malaysia. Our first case was on January 25th, 2020, whereby we had our first case from a Chinese nationality, February 3rd, 2020. But today, yeah, despite of in the beginning, we had been successful in curbing the spread of the disease, yet as of yesterday, 1st of June 2021, the total number of cases has now increased to 572,357. Current active cases, 79,523. The total deaths now at 2,863 deaths. And what's more scary is that what we have accumulated in terms of death this year, yeah, we are now only in June, it's more than what we have for the whole of last year. So despite of preparation, despite of having gone through the pandemic for a whole year, for Malaysia, we are facing a dire situation. So we need to know how to prepare communities in Malaysia to be resilient, one in facing this pandemic, but in the future, how do we go through the pandemic or anticipate the impacts of the future pandemics, but at the same time ensuring that communities can be resilient and coming out well, yeah, despite of these the impacts. Okay, so in terms of community resilience, so what I'm presenting today is towards enhancing community resilience for the communities in Malaysia. When we say community resilience in the past, yeah, we always say that it's about bouncing back to our feet. Yeah, bouncing back, that means we, like what we're facing today, we go through a pandemic and then we go back to the original state, yeah, before pandemic. That means we were doing well, and then we go through the pandemics, and then after the pandemic we should be at least at where we started. So but with that, it means we're going back to the state of vulnerability. Yeah, so we thought we were prepared for COVID-19. If we go back to that, that means we are going back to that state where we are actually not equipped, yeah, to face another pandemic that is like a COVID-19 or even worse. Yeah. So with what COVID-19 taught us is that we have to have a new trajectory. So bouncing back is not an option. Yeah, right now we're facing unforeseen challenges. Yeah, for Malaysia, especially, some countries have come out well. Yeah, for example, Indonesia vaccination is going well. Singapore is going well. The US 80%, they have reached that 80%. Hopefully, they have the herd immunity. So, so we have what COVID-19 revealed to us in Malaysia is that we are facing inadequacies in how we address pandemics. Yeah, it sort of unveil the gaps, yeah, that we have in terms of public health in addressing pandemics. Yeah, so we have to learn to embrace new ways of doing things and try to find ways to become more resilient. So instead of looking at this as something negative, I prefer if we look at this as something positive. Is actually presenting an opportunity for change so that we can bounce forward and face future pandemics better. Right. This is some of our findings from research that we had done last year. What we found that with COVID-19, the way to curb it is to have restrictions in terms of movement, right? So here we call the movement control order. So with that, what comes with that is the barrier to travel, interstate, intertravel, and what it means is that it impacts the economy. It has a trickle down in effects, not just the economy, social, cultural, psychological impacts on the community. So we saw loss of reduction of household income, loss of employment, and we found that there's greater impact for women-headed households. Increase of B40 for Malaysia. B40 are those households that have income of less than 4,849 ringgit. Malaysia.
Dr.
Yeah.
Shaida, there's only 5 more minutes more.
All right. Okay. So with all this, we have the economic, social, cultural, psychological impacts. So where do so what it shows is that what we were really not prepared is an extreme event. It has a compound and system. It is a compound and systemic events. It breaches capacities of communities and government. So where do communications come in? One is that what we see is that there has to be a better integration of the organizations that are involved in terms of working well together, creating the network. Yep. When we talked about communication, when it comes to emergencies or disasters or pandemics, we usually see communication as something to in terms of disseminating information, knowledge. Yeah? But more than that, it should be an enabling tool, yeah, to bring people to work closely together. The what we are proposing in this research is that we looked at the integrated communication network models, yeah, to see how organizations and communities can work better together. We have to look at a better resource allocation. Yeah, we have to revisit from the Malaysian for the Malaysian government, and how do we do that? How do we use a communication to push towards that? We can use advocacy, yeah, public advocacy to demand for better health, education, and social work. Listening and learning is an important part of communication. What's happening on ground zero is really important, because what we saw in our research was that there had been resources in terms of financial help. There's been a lot, but what happened was that it's not getting to the people who really needs it, and there are stockpiles of donations, and we have to be better in terms of knowing, going out there, listening to what they really want. Yeah. In terms of technology, digital platform provide link to the outside world. But in Malaysia, connectivity remains a challenge. Yeah. Our internet grid focused basically along the highways. So those off the grid have a difficulty in accessing the internet. So, don't talk about e-commerce, don't talk about online education if you don't have good broadband, good access here to the internet. So we've also learned that with the industries that we had collected data, the agriculture communities, the agriculture industry, not that affected. And we saw that one way that had helped them was that they use smart technology, smart farming. For those that use a smart farming technology, they were doing quite well. Yeah? So, but on the other hand, digital platform helps, but other key logistics and support services need to be in place. Right. So in communicating for resilience, we push for beyond responding to immediate needs of emergency at hand. We should be looking at the more holistic approach here for community capacity building, adaptation to new realities. The areas that we should be focusing on is the whole communication ecology. We have to do a lot of network analysis to look at what's the breakdown in communication, who are talking to each other and who are not talking to in that network, who are not talking to others. Yeah, and then have the technology to build the adaptive capacities. Yeah. Okay, I'll skip this. Yeah. So we need a whole system approach to break the silos, and more effective decision support system for more timely, consistent, and effective decision making in terms of data and facilities, knowledge and expertise, and then effective use of information technology. I underscored the effective use of technology. We are not using technology for the sake of using technology. We saw a bit of chaos 2 or 3 weeks, a week or two ago, in terms of registration for vaccination. So technology has to help, not to hinder. So bouncing forward,
Dr. Shu.
okay, this is the last one.
Dr. Shu, almost done. Okay,
Okay, yeah,
okay.
this is the last one. So bouncing forward, we have to be flexible and adaptable to quick to adopt new models, and we have to network. When I say network, what we mean is beyond that internet access. Yeah, digitalization is not the answer to all. Yeah, in terms of logistics, in terms of for example, when you use courier services in rural areas, they don't have courier services. So these are the things that we have to think about. Yeah. So I suppose that's my presentation for today. Yeah. Thank you.
Thank you so much, Associate Professor Dr. Shuhaida. Okay, that was a very insightful as well as comprehensive presentation. Okay, I would like to open the floor for any questions towards Dr. Shuhaida. You may use the chat box if you have. Okay, Dayang, all right, go ahead.
Assalamualaikum Dr. Shu.
Hi, Dayang.
Hi.
Your face?
Kejap.
Okay.
Kejap. I don't know why this is happening. Okay, tak apa, tak apa. Saya ada problem sikit. Saya guna webcam ni dia tak connect. Okay, tak
Oh,
apa.
Itulah
we
masalah
can
ni.
see you.
Oh, okay, sorry.
Okay.
Okay. I would like to ask I'm interested to know about the community resilience on the rural population, because you identified orang asli as one of the vulnerable groups. So how is the community resilient dekat sana? I mean, based on your you mentioned earlier, there is a preliminary punya research that you have conducted kan at the northern part of ni. I don't know whether it includes orang asli. Secondly, I would like to ask about your comment on whether or not currently we are integrated tak in terms of our the communication process of this pandemic crisis nali lah.
Okay.
The interagencies that the communication between interagencies. So what is your comment on that?
Okay. On the first one, we did go into the orang asli communities because we were requested to do that, and we know that we have to do that. We went to the Perak orang asli community. What's happening there is that, of course, the internet access, is really poor there. In terms of for some rural areas, they had been able to get on the e-commerce bandwagon, but the orang asli, of course, is nothing that they're not there. So in terms of education, they're left behind. And what we saw that could be helpful for them, and also in other places, is that rather than relying on the internet access, you can rely on other old technologies. You can use TV, you can use a radio broadcast in terms of education. And we found that in the orang asli community that we went, only a certain individuals in the community that that had been able to take advantage of the internet access, especially the what do you call that, the head of the community, So and to have that trickle down effect to the community was a challenge, still a challenge for them. But they do, when we in our questionnaire, they do ask for training, for upskilling in terms of business, and also in terms of doing businesses, and how we can help in connecting them. Yeah, they might have the produce or the products, but how do they sell to people outside the market? They don't have the market, and they don't have the connection. So these are the needs that they want. Yeah. Yeah, the second question was in terms of the integrative or the integrated network. Yeah, mind you, in Malaysia we have MKN, we have NATMA. NATMA has to deal with more. The last I checked was 79 agencies there that they have to deal with. They do have that system, but what in this research that we're proposing, you can't just look at bouncing back in terms of the integration. Right now, we're focused very much into overcoming this pandemic. Yeah, but in terms of community resilience, it has to be wider in terms of businesses. Yeah, so in terms of in pandemic or in disaster response, in terms of response and recovery, the network is there. But in terms of moving forward, in terms of building community resilience, being able to come out better in terms of the economy, in terms of social resilience. Yeah. The integration with the communities, with the NGI, non-government individuals, NGOs have to be better. So in terms of response and recovery, I have to say we're good. Yeah, we have the systems in place. It can be better, but in terms of a better, a more this to widen the scope, to include the economic recovery and economic resilience that has to be improved, I think.
Thank you, Dr. Shu.
Yeah. All
For
right.
the insights.
Nice to see you.
Okay.
You too. Terima kasih.
Okay.
Okay, thank you so much, Ms. Dayang, Aiza, as well as Dr. Shohaida. Okay, is there any other questions? I think we do not, we have exceeded a bit of time. Okay, all right, thank you so much. Thank you, Dr. Shohaida. We will proceed with the next presenter. Okay. All right, so the next one will be, okay, just hold on a moment. I think I hear something. Mr. Morrison, is it possible that I mute? Okay, all right. So for the next presentation, it will be from Professor Fei Yang Chen, Northeastern University, China. Okay, her study will be on community mobilization based on new media in the context of epidemic prevention and control. I think Azmina would play her video right now.
Good morning, ladies and gentlemen. I'm Chen Feiyang from Northeastern University, and the title of the paper I'm presenting today is Community Mobilizations Based on News Media in the Context of Epidemic Prevention and Control. Firstly, an introduction about the background and purpose of the study. The prevention and control of the new COVID-19 epidemic has become a focus test of the national governance systems and governance capacity. In grassroots epidemic fighting practice, the relative separations of geographical space under the reality of homes based on prevention and control has led to a wider and deeper use of new media mobile surveillance in services. The applications of new media mobile surveillance, such as WeChat, for community mobilizations in the process of organizing epidemic prevention and control has made an outstanding contribution to enhancing the efficiency of community actions and building consensus on epidemic prevention, providing a new pace for exploring new media-based community governance approaches for major public crisis events. After reading the lectures to sort out the histories of research related to community mobilizations models, We raise these two questions as the starting point of the study. What are the interpersonal relationships and communication networks of communities based on new media science in the context of epidemic prevention and control? What are the corresponding mobilization strategies? In terms of research methods, these papers mainly used online participatory observations and online ethnography methods. K community was selected as the research object, and WeChat, which is often adopted under the actual applications scenario of communicating mobilizations, was used as a representative of the online observation of WeChat group contents from June to December 2020, and 3756 chat records within the WeChat group of K community were recorded, which was provided an ecological sample with a high degree of restorations and good integrity for the study. In the study related to mobilizing subjects, the structures, characters of community communication networks based on relation origination were explored through visual images, and the centuries of communication networks nodes were analyzed and ranked according to the centrality of vectors to uncover important nodes that undertake the taskings community mobilizations subjects. The results show that interactive and participatory community media has changed from passive information recipients to active information receivers and information disseminators. In addition to the high level of the online media power of community committee workers who represent the downward seepage of state power, community residents represented by community volunteers also show a high level of participation in the community residents empowered by new media. Next, the interactions between nodes and clusters had analyzed to explore the embeddedness and mobility of communication mobilizations targets. It can be seen that community communications has formed small work groups of different size, and grassroots organizations has difficulties in mobilizing residents directly in practice. They have the identities of mobilization subjects and mobilization objects and transform their identities in the community communication circle, forming circle ties and reducing the cost of administrative information transmission to society and the cost of community mobilization. Third, the community mobilization object mainly depends on the mobilization expectations of community mobilization. The mobilization expectations comes from the communication context in communication practice, and the identification of key community mobilizations objects in specific context comes from the communication symbols that carry the themes of mobilizations discourse, WeChat groups, chat records. In these papers, we use Python tools to analyze the word's frequency of the task of communicating. WeChat groups, chat records. The results of the word frequency analysis focus on the main topic of K community communication systems. the prevention and control of the new COVID-19 epidemic, it can be seen that key community mobilizations objects is more in line with actions mobilization category of the process and behaviors of advocacy, associations, and motivation to intensify specific communication actions. The study of communication mobilizations methods has been disconstructed mainly from two perspectives, the form and the connotations of communication symbols. Statistics on the use of communication symbols shows that the highest frequency of carrier is text. This is related to the content and the context of communication. WeChat is a speech practice, but it has the characteristics of recording compared with real space conversation. On the transmitter side, text-based communication symbols are more regular than other communication symbols because they are operate and verified through information filtering, and they are more suitable for communication mobilizations in the context of epidemic prevention and control. Finally, an approach to community mobilizations based on news media is proposed. The first is to constructions of a mobilizations platform based on news media. Based on the community network, it can enhance the participation of the community network and the efficiency of crisis responses and strengthen the effect of mobilization. Secondly, the effectiveness of mobilizations under the mediation of community sensitives is enhanced. Community administrative organizations represented by neighborhood community provided the basis for the formation of a sense of community by building a platform for community activities and shaped information for the cultivations of a sense of communities. As an corrective element in the field of community governments, media such as WeChat groups are a form of horizontal social contentions that facilitates the communications of community capital and creates a strong synergy between grassroots administrative organizations and community residents in collaborative governments. On the other hand, the rumors granted by the community communication systems are also a test of mobilizations of community government's capacity. This suggests that in the progress of effective communities mobilizations through the use of new media, community governments should develop communication strategies that take into account the specific circumstances of community and adapt to the pace of social transformations at the grassroots levels in terms of media embedding and community mobilization paths. This paper still needs to improve, and we will communicate more with all authors.
Okay, thank you, Puan Azlina, for playing the video. Unfortunately, Miss, sorry, I was, I think, confused by her name just now. She's actually a student at Northeastern University. Miss Fei Young, is not able to join us today. So there would not be any Q&A session from her side. Okay. All right. We will proceed with the other presenter, but before that, I can see that there's a bit of a similar kind of research between Associate Professor Dr. Shuhaida as well as Ms. Fei Young, but hers is more on community mobilization. But it's both are doing the same thing, which is about prevention and resilience and so on due to the pandemic. Okay, let's go to Muhammad Hafifi Jamri. He is from University Science Malaysia. He will be talking about his study on the use of electronic media in drug abuse campaign. Mr. Hafifi, I believe that you had mentioned that you want to play the video, right?
Yes, Dr. Tika. Yes.
Are you going to play it or would you like us to play it for you?
Madam Azrina will play for it.
Okay, thank you so much.
Thank you so much. Thank you.
All right.
Assalamualaikum warahmatullahi wabarakatuh and a very good morning to all. Welcome to my presentation. Let me briefly introduce myself. My name is Muhammad Hafifi bin Jamri and I am a PhD candidate working under the guidance of Dr. Nurizali Ismail and Professor Dr. Jamila Haji Ahmad. It is an honor for me today to stand in front of you to deliver a presentation. The topic of my presentation is a study of the use of electronic media in drug abuse campaigns. First of all, I would like to give you an overview of my research topic. In this modern era of globalization, the media plays a crucial role. It becomes a public dissemination mechanism that makes it easier for people to get information from both within and outside the world. The influence of the mass media is not only about disseminating knowledge, but also about shaping society's way of thinking, perceptions, societal expectations, and behavior. Electronic media is one of the outlets for disseminating contents to the general public. Television and radio are examples of electronic channels that play an important role in influencing consciousness. In Malaysia, electronic media is used in a variety of campaigns, including the drug abuse campaign. Despite the fact that a number of drug abuse campaigns use this platform as a preventive and educational tool, the country's drug abuse issue remains alarming, especially among the youth. In addition, studies to assess the effectiveness of the use of media, especially electronic media, are very restricted. Based on this research gap, the objective of this study is 1. To ascertain the extent of use of electronic media among Penang youths. 2. To assess the effectiveness of the drug abuse campaign's electronic media strategy among Penang youths. And 3. To investigate the use and effectiveness of electronic media by the National Anti-Drug Agency in Malaysia's drug abuse campaign. In order to achieve all of these objectives, this research employs a cross-sectional mixed method design. For the quantitative method, a total of 400 respondents aged 18 to 29 were recruited in the state of Penang for a questionnaire survey using a combination of 3 sampling methods, namely purposive sampling, quota sampling, and convenience sampling. Meanwhile, for the qualitative method, a total of 12 informants were recruited via the purposive sampling method for in-depth interview session consisting of National Anti-Drug Agency officers, NADA, at the central level and in the state of Penang. In terms of data analysis techniques, this research employs a SPSS version 24 software for quantitative data analysis, while the thematic analysis approach is employed for qualitative data analysis. The results of this research are divided into two categories, which is quantitative findings, survey questionnaire, and qualitative findings, in-depth interviews. Based on the analysis, the findings of this study are presented in a descriptive manner. For quantitative results, in terms of demographics, the result of this study revealed that 328 of the 400 youth respondents recruited for the sample survey of this questionnaire were male and 72 were female. The majority of respondents were Malays, and according to the findings of the statistical report, the average mean time period of electronic media use within a day by 400 youth respondents surveyed was 2 hours for television and 1 hour 30 minutes for radio. The majority of those polled have stated that they use electronic media to access information, 64.5% of respondents, as well as entertainment resources, 52.8% of respondents. Furthermore, in terms of the effectiveness of electronic media strategy, descriptive analysis revealed that a mean score of 3.79 was obtained for the time strategy construct, a mean score of 4.01 was obtained for the message strategy construct, a mean score of 4.01 was obtained for the language strategy construct, a mean score of 4.00 was obtained for the media channel construct, and a mean score of 3.91 was obtained for the presentation strategy construct. For qualitative results in terms of demographics, the study's findings revealed that 8 of the 12 informants who participated in the in-depth interview session were male, while 4 were female. Majority of informants interviewed have worked with NADA for more than 10 years. The key findings showed electronic media is one of the media identified by the majority of informants as being used by NADA in the promotion of the drug abuse campaign. In this case, information on the dangers of drug abuse is conveyed through television and radio slots. NADA has secured slots on Radio Television Malaysia (RTM) for Selamat Pagi Malaysia, TV Al Hijrah and talk shows, for example. Meanwhile, Trax FM, an English language radio station, is one of the radio stations that has broadcast knowledge on the risk of drug abuse. In fact, the NADA's HQ also encouraged the NADA state to collaborate with the Department of Information in each state, RTM state, and radios other than RTM. Furthermore, most informants regard electronic media as an important means. In addition, the benefits of electronic media, such as radio having its own listeners, offer an incentive for NADA to disseminate awareness about the danger of drug abuse to the target audience at specific times. For discussion part, I will discuss the main findings of this research only. For quantitative results in terms of time strategy, the findings show that the NADA's advertising time orientation is acceptable and can be strengthened. Referring to previous research findings on advertising, a study conducted by Rao et al. 2014 on mobile advertising on mobile phones revealed that the effectiveness of mobile advertising is better under low time pressure context than high time pressure context, and advertisers should choose the time space in which users are in a state of relaxation, for instance during lunch breaks or on weekends. In terms of message strategy, the findings show that the overall drug abuse risk advertising message delivered by NADA has an effect on the viewer. In terms of previous research by Kier et al. 2010, it was discovered that there is a positive and important link between message and the effectiveness of anti-drug campaigns. In terms of language strategy, the findings of this study clearly show that the usage of language for media ads in the drug abuse campaign as a whole is relevant to the present context and accepted by society. This is consistent with explanation by Saad and Arifin 2014 in their study about the significance of selecting a language in an advertising so that all levels of society can understand it. In terms of media channel, the findings show that the NADA's use of media channels to display advertising about the risk of drug abuse is beneficial and successful for the society. This is consistent with explanation by Alan et al. 2016 in their study that the diversity of media and communication channels is now gaining traction in society due to its function of informing and making the community aware of various things, including disease outbreaks. In terms of presentation strategy, the findings demonstrate that the method of displaying advertising of the risk of drug abuse in electronic media is successful in providing impact to the viewer. In this case, the researcher proposed that the NADA upgrade the current information presentation strategy, which is in the form of text-only document element, to a more interesting form, which is infographic. Aside from being able to draw readers and boost their memory, the presentation of information to the viewer is referred to easily and efficiently by conceptual ideas, which are a mixture of document elements and infographics. Next, when the results of in-depth interviews are examined, it is discovered that electronic media are selected as an effective means of information delivery. In terms of international research results, electronic media also has its own potential. According to the results of a study conducted by Michael et al. 2014 among advertising practitioners in Nigeria, 32% of respondents selected radio as their primary advertising medium. Furthermore, the study's findings show that radio is the most commonly used advertisement medium in Nigeria by advertising practitioners for advertising campaigns, reinforcing the belief of some scholars and advertising practitioners that radio is the most prominent mass media in developing countries. Overall, electronic media's usage as one of the information dissemination mechanisms in the drug abuse campaign is still acceptable and important in the current context. The benefits of this platform should be refined further so that it can continue to assist current campaigns. Improvement in media consumption habits and innovation may also be made to strengthen the campaign. Furthermore, this research clearly makes substantial contributions in terms of information addition in the fields of population and health. The result of this study indicate that despite the rapid development of communication technologies, traditional media such as electronic media remain successful as a medium that aids campaign in the dissemination of knowledge to the public. In fact, given the potential usefulness of this electronic media platform, this study will serve as a valuable resource and guide for the National Anti-Drug Agency and other stakeholders in identifying new elements that can be implemented. The result of this study can also be used by future researchers to broaden the reach of current studies. This study would like to thank University Science Malaysia for funding research projects, theorizing crime prevention on social media, analyzing persuasion and impact through the Fundamental Research Grant Scheme, FRGS. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Puan Azlina, for playing the video. And thank you so much, Mr. Hafifi, for your comprehensive as well as interesting presentation on drug awareness campaign, on its effectiveness. Okay, I open the floor for any questions from the participants in this parallel session. You may ask via chat or maybe just unmute and just ask question to Muhammad Hafifi. Okay, since there's no question yet, so maybe I can ask a question for you, Mr. Hafifi. All right. Okay, so you were telling us that your study is on electronic media, right? On radio, actually, the one of the traditional media for advertising. So you mentioned that it has shown some effectiveness in terms of delivering messages for AADK or NADA. Okay, so but you mentioned there are some recommendations in terms of infographic visuals to make it more interesting rather than just the words. Okay, so how when you mention about this recommendation, what platform do you propose for the drug awareness campaign to work on rather than radio?
Rather than radio, I mean, you mean other than platform other than radio?
Yes, because just now you mentioned one of the recommendation is infographic,
Yes.
visuals, and so on. So what kind of platforms would you propose based on the data that you have gotten?
Okay, thank you so much. Actually, if you ask me about this question, actually, NADA itself actually use all the platforms. We have 5 platforms actually. We have electronic media, we have print media, we have social media, we have outdoor media, and we have one more is what we call the face-to-face medium. So all of this platform is actually being used by the NADA itself to promote or disseminate the information to the public. So this study is just a refer to the what we call the electronic media itself, but in the context of radio itself, that I said that the radio itself have their own listeners. Yeah, that we have Hot FM that focusing the audience itself to the Malay audience, for example, or the Mandarin radio station that focus in that kind of things. So I think that rather than infographic itself, that I give the recommendation itself is actually to the electronic media for the what we call the print media itself. For electronic media itself, what we call the infographic itself, put it in electronic media, but it actually can be adapted in other media like print media or social media itself. Now we have infographic that have been what we call that presented in the social media, where the Facebook, AADK Facebook, NADA's Facebook, they create a design of the poster, e-poster, then they upload it in the Facebook and show it to the people. That kind of way actually what we call that is effective in the context of dissemination of information, because people now, teenagers, youth, even what we call that, all of Malaysian, I focus in Malaysia, they are towards the directions of using social media itself as a platform they are referred to, rather than other media. But we cannot say that electronic media is not relevant. It's still relevant. If not relevant, then it will not be used until today by the government or other stakeholders to promote anything. So that kind of thing is very important for us to see it in the positive way. It means that all of the media is very important, and for me, I think for now, if you ask me personally, I will say that the platform is the best platform.
Okay. All right.
Even though my paper is about the electronic media, but if you ask me personally, I will say that it is social media.
Yes, that's right. So because recently, I mean last semester, my final year students actually did a campaign for NADA, for AADK, and then they did it through social media. But one of the core problem that we saw was that we did it in English, and some of the participants of our contest, our engagement from our social media mentioned that we should focus on other language. So just now you mentioned about language is one of the things that you look through, right?
Yes.
Can you just elaborate more on, because based on our AADK information, we saw that there are certain numbers of drug addicts, in terms of from the Malay ethnicity as well as other ethnicities, but the highest one is from Malay ethnicity. And then that was a problem in our campaign, was that one of the participants actually told us that we should do it in Bahasa Malaysia, not in English for our campaign. So can you comment on that, on which language is the best to actually give awareness to everyone about this drug addiction problem and how to combat that problem?
Okay, thank you so much for that question. It's a very good question actually. Actually, for now, yes, NADA itself, they are using 2 languages, if I'm not mistaken. Like the majority of the advertisement being using by NADA itself, they are using 2 languages, which is English and Malay. But for me, personally, when I do the survey itself, when I did the survey with the respondent from youth, they are giving comment about this also, about the language, when they are saying that yes, in the print media we have what we call a Chinese print media. Yeah, we have they have also a news about the drug issues and things like that. But in the context of the advertisement from that kind of language, that also misuse the drug itself. So it is good for us to actually use all the main language in what we call that in Malaysia, to disseminate information using the poster, using what we call a video, or what we call that any kind of media, yeah? Any kind of media, but using all of that kind of language, so that the people in Malaysia will understand in different way. Yeah, maybe Malay, for Malay people, they cannot understand what kind of song what is that. Maybe they are song about the drug itself, but in Chinese or in Mandarin language, they cannot understand. But they know that it is all about the drug abuse problem. Some you can say that like before we have One Malaysia campaign by Datuk Sri Najib Tun Razak. Yes, Datuk Sri Najib Tun Razak is using what we call the Malay language, but it is actually being understood by all the people with the subtitle under the song or the video itself. There is a subtitle. Malay, English, and what we call that Mandarin. They did not put what we call that Tamil language that time. They put Chinese, Malay, and English, if not mistaken. So that kind of strategy itself is actually the strategy is that is good strategy to promote and to increase the awareness of the people. Yes, thank you.
Okay, thank you so much, Mr. Hafifi. All right, are there any questions for Mr. Hafifi before we end his session? All right. Okay. So thank you so much, Mr. Hafifi.
Okay, thank you so much,
That was
Dr.
very
Atika.
insightful, and
Thank
you
you.
have really already answered it comprehensively. Okay. All right. So our session has ended. Before we end the whole thing, we would like to request for a picture session. Okay. All right. So maybe we can have just one picture session with all of the members inside. I hope everyone is still here. Okay, Dr. Shraddha is still here, Morrison is still here, and you are still here. So, okay. All right, you can just on your cameras for a while, and then we'll just take a picture along with other participants also, if they would like to show their faces. Mr. Morrison, are you here? Dr. Shu?
Hello.
It's just both of us. Okay, Hui Ling, you can just on your camera so we can have a photo session. Okay, Dr. Shu
Shraddha
is back.
there.
Okay. Apa, okay je. Mr. Morrison, Paulina, Encik Mawi, boleh je together. Tadi ada ramai, tu dah habis, dah semua dah pergi ke tempat lain.
Kak Ina lari dah.
Kak Ina ada. Semua pergi makan.
Masih work vacuum lah pula kat belakang ni.
Tak apa, doktor. Alright, I think Mr. Morrison is out, so we can just take our picture.
Okay.
Encik Mawi akan ambilkan ke? Saya pun boleh print screen, okay. 1, 2, 3. Alright, thank you so much.
Okay. Thank you so much, Dr. Atika. Thank you, Dr. Shraddha.
No problem. Thank you so much for all of the presentation given by all participants. We hope to see you, and do join us for our workshop tomorrow from our librarian on fraud. and plagiarism in research. Okay, thank you so much. Goodbye.
Thank you. Thank you, Dr. Jared. Thank you, Dr. Tika. Assalamualaikum.
Wassalam.